there, it's Amanda Pratt, licensed clinical social worker at Imagine Life Therapy, and I'm the chronic illness therapist. Today we're going to talk about cognitive behavior therapy. What is it good for, and why do so many people use it? Cognitive behavior therapy is a specific type of therapy that you've probably heard a lot about. There's a lot of evidence and research behind it. So today I want to teach you what exactly it is and what it can do for you. Cognitive behavior therapy was created by a guy named Aaron Beck, and he developed this form of therapy in the 60s, and it was originally called cognitive therapy, but now when we hear words like cognitive therapy or cognitive behavior therapy, or even by its acronym CBT, that's what it's referring to. This type of treatment is based on the idea or the model that says that dysfunctions in our behavior can actually start with our thoughts, as well as negative feelings we might be having. For example, if you go out and say you bounce a check, and then you feel really bad about that, you might have an automatic thought that comes up right when that behavior happened, like, I can't do anything right. And after you have that thought, that's when you really start to feel bad. And then as a result of that thought and that feeling, you might then retreat to bed for the rest of the day, and that's the behavior. So we say that cognitive behavior theory proposes that our thoughts, feelings, and behavior are all interconnected, and if we can interrupt this process and adjust it, we can affect our behavior and our feelings in a positive way. Essentially, what we try to do in cognitive behavior therapy is we try to flush out different thought habits or beliefs that you might have that might be influencing your feelings and your behavior in a negative or unhelpful way. Research and evidence that supports cognitive behavior therapy is really outstanding. There are over 500 studies that have shown that cognitive behavior therapy is effective for a wide range of different problems. Some have shown that it helps with psychiatric disorders, psychological problems, and even medical problems that can have a psychological component. So this is why CBT can be really effective for people who have chronic health problems, because most chronic health conditions, as I'm sure you've heard me say in other videos, come with depression a lot of the times. Depression is the number one co-diagnosed condition with any chronic medical disorder. It can also bring up anxiety. If we have a chronic health problem, there are a lot of aspects of living with chronic illness that can bring up anxiety. And so CBT can be great for those situations as well. It can help with disease management. It can help with different learning disorders like ADHD. It can help with panic disorder. If your anxiety has gotten so severe that it has moved to panic, that can be helpful. And we also have different types of CBT, like exposure therapy is a form of CBT, and a lot of times we use that for things like social anxiety. So there are a wide range of uses for CBT, and it has been shown effective for many of them, including managing chronic illness. One of the great things about cognitive behavior therapy is that it's really formulated and specific to whatever problems you might have or might come up during the course of your therapeutic relationship. We say that cognitive behavior therapy is always evolving, right? You might bring in a problem to therapy, and that problem might bring up a specific set of thoughts, feelings, or behaviors for you, and we're going to look at that specifically for you. So it's very individualized. The other thing about cognitive behavior therapy is it really requires that you have a great relationship with your therapist. We call this a therapeutic alliance. The only way that cognitive behavior therapy is going to work is if you really feel comfortable with your therapist and you feel that you have a good relationship therapeutically. The other thing is that it's a collaboration. Your therapist is not going to presume to know what's best for you. They're going to be there to help facilitate you getting a greater understanding of your own thoughts, feelings, and behaviors. But ultimately, you're collaborating and working together to understand those things. The other thing that I love about cognitive behavior therapy, and something I hear from my clients a lot, is that they love that it's structured and it's goal-oriented. Sometimes we can go into therapy and feel like we're just going in every day and spewing out what happened to us, but we don't have any tangible skills or goals or lessons that we learned from those sessions. And the great thing about cognitive behavior therapy is it is structured and it is goal-oriented, and we problem solve. We look at what the problems are, and then we will move toward working on a solution. It offers very tangible strategies and also a lot of psychoeducation. This is something that I use in my practice and something that I have found very helpful for myself in managing my own chronic pain and chronic health problems. So I just wanted to give you a little bit more information about cognitive behavior therapy and what it can do. If you have any other questions, please feel free to drop them below, and I am happy to answer them for you. And this is Amanda Pratt, licensed clinical social worker and the chronic illness therapist with Imagine Life Therapy.